opposite to circle hairs, also known as pigtails, seen in alopecia areata. So these are new anagen hairs, very regularly coiled, with pointed distal part, opposite to this coiled hairs seen in Trichoteilomania, which is this distal part is very irregularly coiled. Sometimes you can see some strange features. We can now call this feature also a coiled hair, but it is looking strange. And a subtype of these coiled hairs, typical for Trichoteilomania, are hook hairs. They are coiled very hardly at the distal part of this short hair, so they are also known as question mark hairs. And the V-sign. V-sign is created in Trichoteilomania if the patient is pulling out the 2 or 3 hair shafts with the same force at the same time. And this is probably because of the anatomical closure of these 2 or 3 hair shafts which are placed in one follicular unit. So V-sign, actually these are 2 or 3 short hairs in one follicular unit, what is not so commonly seen in other hair shaft disorder. Even if you think about alopecia areata, usually you will see only one exclamation mark hair in one follicular unit. So for Trichoteilomania, search for V-sign, so 2 or 3 short hair shafts in one follicular unit. And this is an example in which you can see V-sign. On the right side, this is a hook hair, V-sign, with 2 short hairs uniform in size, and here is a hook hair. So diagnosis in this case is very easy. And once more, V-sign, 3 short hairs in one follicular unit, and here again V-sign with hook hair, V-sign with a short hair shaft resembling as exclamation mark hair, because remember that exclamation mark hairs may be visible in the course of Trichoteilomania, but they are solitary, not numerous like in androgenetic alopecia, like in alopecia areata, sorry. And the tulip hair, this is another specific feature for Trichoteilomania, with darker portion of a hair shaft. It looks like the hair shaft is empty inside, and the name, of course, is caused by the shape of this distal part resembling as a tulip flower. Sometimes patient doesn't pull out the hair shaft very close to the scalp. So in these cases, you can search for distal ends of the hair shafts, and if this is caused by Trichoteilomania, most probably you will observe numerous pili-torti ends of the hair shafts. And this is an example of a patient with numerous tulip hairs. You can see that they are not uniform in size, but quite uniform in shape. The majority of them are with this dark distal portion of the hair shaft. And in high magnification, you can also see sometimes black dots, as Anna told you before, because the black dots in Trichoteilomania are caused by pulling out the hair shaft close to the scalp surface. And other features, the short hairs are not uniform in shape and size, so they are irregular, and here you can also see some tulip hairs. And micro exclamation mark hairs, as I told you before, they can be found in Trichoteilomania, but they are solitary, not numerous like in alopecia areata. And the summary, to set a proper diagnosis, we are searching for irregularity, and we are searching for specific features like a flame hair, tulip hair, coiled hairs, hook hairs, and a V-sign. So this is the spectrum of Trichoteilomania features in trichoscopy. And this is an example of a patient with this specific subtype resembling as sometimes frontal fibrosing alopecia. And in trichoscopy here you can observe numerous not irregular in shape and size short hairs, so the diagnosis is very easy. Another patient, you saw the clinical picture before, but now let's look at trichoscopy with